Our next presenter is Grace Kuiper, and she is with our program in Environmental and Radiological Health Sciences at Colorado State University.
Hi, thanks, Steve. I will start sharing my screen. Okay. Thank you for the introduction. As Steve said, my name is Grace Kuiper. I'm going to be presenting about the pesticides in the Central Valley of California. So, sorry, I'm trying to get my screen sorted out here. Okay. So California is the #1 state in the country for agriculture and produces the most crops in the U.S. So to support this agricultural industry, there are hundreds of millions of pounds of pesticides applied every year in California. So we know that pesticides may increase risk of different cancers and also neurodegenerative diseases, impaired neurodevelopment in children, and also adverse respiratory health outcomes, especially among agricultural workers and their families. So with the help of HICAHS funding, we conducted the study of environmental mixtures and periurban respiratory outcomes, or semi-pro, and our field team was supported to conduct 2 sampling visits to the Central Valley of California. So our study was conducted in Fresno and Tulare counties, which according to the Census of Agriculture, the USDA 2017 Census of Agriculture, are ranked 1st and 2nd in the country for agricultural products sold. And we visited during January and June 2019 in order to capture the pesticide non-spraying and spraying seasons. We recruited 80 participants from 34 households, and inclusion criteria included a minimum age of 7 years old, and households had to be located within 200 feet of an agricultural field. During each visit, we surveyed participants to collect information about their health, occupational exposure, and household characteristics. We also collected urine samples and household dust samples using a high volume, small surface sampler. In the urine samples, we measured concentrations of leukotriene E4 or LTE4, which is a marker of respiratory inflammation, which has been previously studied primarily to examine allergen and asthma exacerbations. We also measured concentrations of dialkyl phosphates, or DAPs, which is an organophosphate pesticide metabolite. And lastly, we looked for the presence of 3,5,6-trichloro-2-pyridinol, or TCPY, in the urine, which is a metabolite of chlorpyrifos. And chlorpyrifos is the most commonly applied organophosphate in this area, according to the California Pesticide Use Registry. So we also looked for concentrations of organophosphates in the household dust samples, and we looked at the most commonly applied organophosphates according to the Pesticide Use Registry. So our research objectives were to conduct a comparison of exposure assessment methods, specifically looking at pesticide exposure in these agricultural communities. We also hope to conduct epidemiological analyses to look for potential associations between pesticide exposure and lung health. And we will be looking at important factors that influence pesticide exposure among these agricultural communities. Okay, so our preliminary results show some interesting findings about factors that influence pesticide exposure. So one of the reasons we chose California as our study area is because it's one of only 2 states to have a pesticide use registry. And with this robust data set, we were able to see that there are pretty significant seasonal trends in organophosphate application in our study area. So this timeline shows seasonal trends in organophosphate application broken down by total organophosphates, chlorpyrifos, and malathion, which is the second most commonly applied organophosphate in this area. And although the pesticide use registry reports seasonal differences in application, we did not detect any seasonal differences in OP levels in our household dust samples, which suggests that organophosphates may persist for long periods of time in an indoor setting. We also were interested in looking at secondary occupational exposure as a potential factor that influences pesticide exposure because many participants and many people in these agricultural communities work in the fields. And so we assessed secondary occupational exposure by a survey question that read, does anyone in the house work in agriculture or have contact with pesticides at work? So these plots, which have different scales on the y-axis, show differences in concentrations of total organophosphates, malathion, and chlorpyrifos by secondary occupational exposure. So we did observe statistically significant differences in total organophosphate and chlorpyrifos concentrations in the household dust based on secondary occupational exposure. We were also interested to see if secondary occupational exposure impacted urinary LTE4 concentrations. And we did observe a higher urinary LTE4 concentrations among participants who experienced secondary occupational exposure. However, these differences were not statistically significant. And a linear model, which included secondary occupational exposure as a predictor of urinary LTE4, also was not significant. However, it's possible that this insignificance was due to numerous outliers, so we're going to be conducting additional analyses to try to suss out these differences in urinary LTE4. So in the future, we plan on conducting additional comparisons of exposure assessment methods. And particularly, we would like to compare the California Pesticide Use Registry, the household dust samples, and urine samples to detect any potential correlations between those three different methods of assessing exposure. We're also conducting best subsets regression to identify important factors that influence pesticide exposure levels. And further, we will conduct additional epidemiological analyses to detect any sort of association between pesticide exposure and LTE4 concentrations. And also, I have a manuscript in writing that will include the results of the best subsets regression and epi analyses. So also, I want to talk about our next steps. Using this pilot data, we were able to successfully be awarded a R21 grant to study a chlorpyrifos cancellation that's going to be occurring in California at the end of this year. So we are going to be leveraging this chlorpyrifos cancellation to conduct a natural experiment to compare lung health and also pesticide exposure among our participants in this year versus next year. So currently we're in the process of recruiting participants. We plan on doubling our sample size, and we will also be conducting consent and surveys in the next few weeks. We're also preparing a remote sample collection campaign where we will send our participants their sampling materials and they will return their samples to us. And then we will do the same thing in a year and be able to conduct laboratory analyses on gum swabs, urine samples, and household dust wipes in order to compare pesticide exposure levels before and after the chlorpyrifos ban. We're also in the process of writing an R01 grant proposal. So we would like to take into consideration the voices of the community members with whom we've worked during the semi-pro study. So we asked our semi-pro participants to tell us what other concerns they may have about their environment. And 21% of our participants mentioned water quality, 64% talked about pesticide application, 30% discussed air pollution, and 36% reported specific concerns about their family, friends, or neighbors or pets' health related to the environment. Also, we're proud to say that 100% of our participants agreed to participate in future research. And in fact, there's currently a waiting list to be able to join our next study. So we would like to capitalize on that relationship to increase community engagement and community-based participatory research for our R01 grant proposal. We'd also like to increase laboratory analyses, exposure and health outcome assessment and sample collection. We're considering spirometry and conducting personal air monitoring for agricultural workers. We would also like to consider tap water testing in nail sample collection. We plan on increasing the sample size and also conducting additional exposure and mixtures analyses. So with that, I'd like to, of course, thank HICAHS and also the Central California Environmental Justice Network, who was instrumental in doing our recruitment and forming a relationship with the community in the Central Valley. And also some of our work was supported by an NIEHS K award. Thank you.
Thank you, Grace, and congratulations on your new grant, and got some great ideas for the future here too.
Well, it's mainly the question is you need to describe your sampling frame and also the sample demographic and occupational relation to the agriculture occupational status of the responders, because this will be very important, especially in these two counties. These two counties have several diversified agricultural products, and as the exposure to the pesticides could be very important to know. And maybe you have that, but it was not presented. Over.
That's a great question. We have information about whether or not the participant works in agriculture as a broad term, but don't have specifics on what role or what type of agriculture they work in. We did talk with participants and realized that kind of that shortcoming in our survey questions during sampling, particularly when we talk to some participants who maybe work in packaging or work in other areas of agriculture that are maybe not as directly associated with pesticide exposure as working in the fields. But that is something that we hope to ask better questions about in the future. We also are focusing on specific communities, and these people in these communities tend to work in the fields that are just neighboring those communities. So we're able to kind of suss out exactly what pesticides may be applied in the area based on which community they live in. And we hope to do some sort of hierarchical modeling to look for any sort of clustering effects by community to hopefully answer part of that question. That's a really great point, Dr. Salmon. Thank you.